Okay, welcome class to the second section of your textbook. This is known as 3B. In our case, it's 2B. We are going to be looking at biological basis. This unit particularly is studying the brain and the structures of the brain and the functions of the brain. So the first little presentation we're going to talk about here today is techniques for studying the human brain, the functions and structures. Most of the information can be found on page 69 to 73 in your textbook. I would be taking notes on page 9 and 10 in your packet for this presentation. So first thing to talk about, or your notes kind of mentions, is how they study people's brains. Is a lot of times they do case studies. They find out about the different structures of the brain because of different accidents that have taken place on particular people. It's really hard to kind of experiment with people's brains because it's unethical to just all of a sudden start prodding and poking at my brain. But if I did get into an accident and there's a part of my brain that's damaged, this is when they do clinical observations. They observe me and they do a lot of case studies, an in-depth case study on maybe different tests that they give me, different questionnaires that they give me, and maybe they do different scans with me to see what particularly is happening with me. Okay, we're getting a lot of information now on how concussions they're saying that later in life, if you get a certain number of concussions, it can cause you to have issues with depression. So we're looking at a lot of people who have maybe particularly passed away. We're studying and analyzing their brains to try and find out whether or not it could be a cause of depression. Lesions is another way to particularly study the brain. It's ways to explore the inner workings of the brain. Scientists usually destroy or remove certain areas that are defected in the brain and leave the surrounding tissues unharmed. They pretty much only do lesions in animal behavior because it is very unethical to remove these from a human brain. In the book, it talks about how they removed, a rat was having issues with eating, and so they removed a portion of the rat's brain, the hypothalamus, which is responsible for eating and drinking. And they removed that rat's portion of the brain to see whether or not his behavior would change. So they're finding out a lot of the functions of the brain, what they're responsible for doing by doing certain tests like removing the lesions of the brain. And here's an image of a person's brain removed, a section of the brain, which might be something like a lesion. Okay, so the electroencephalogram is one way to test the brain activity. It does not show specific areas of the brain are impacted. It just pretty much watches the neural firing of the brain. It is a recording of neural activity by electrodes. It pretty much watches the firing of neurons. In the book, it uses the analogy, I believe, of when you're studying a car and trying to figure out what is wrong with the car. What an electroencephalogram would do is it's actually just listening to what's going on. Actually, this one is just watching, so we'd be just listening to the hum of the car. You're not actually opening the hood and detecting the different structures of the brain. So this is just kind of getting a snapshot of kind of what's occurring to the person's brain as they're watching the firing, but you're not really knowing or detecting what specific areas of the brain are responsible for different behaviors. A lot of the times they're used for sleep studies. They see whether or not your brain is active when you're sleeping. They help understand different seizures people may have. It's also known as an EEG. It's probably a little bit easier to say. The advantage of doing an EEG is it detects very rapid changes in electrical activity, allowing analysis of stages of cognitive activity. A disadvantage is it provides poor descriptions of the source of electricity. So kind of where the electricity is actually coming from, kind of what I was talking about before. It doesn't show you exactly where it's coming from. And here is an in-depth image of somebody who was getting an EEG done. Imagine if you were going for a sleep study and you had to sleep with all those different electrodes on your head. So computerized axial tomography, otherwise known sometimes as a CT scan or a CAT scan, is a three-dimensional view of the brain. CT scans are specialized types of X-rays, particularly used for the brain. Let's say that you think that you cracked your head and you think that maybe, oh my gosh, she cracked her skull. CT scans are usually very good for looking at the bone of an individual. Usually CT scans are done with MRIs or another type of scan because CT scan just kind of reveals what the bone is looking like. So if you see this image here, it's really looking at the bone structure or the skull of your brain or of your head. CT scans, what a CT scan shows, kind of what I talked about, examines the brain by taking an X-ray. Advantage is it's really good for bone structures, but it doesn't reveal too much about the inner structures of the brain. So kind of if you want to know a particular structure again, which structure is damaged, it's not going to reveal that. So it kind of just looks at, if you're looking at your car per se, it's looking at, is there a dent in the side of your car? It's not really saying, you know, particularly what's going on under the engine or the structures of the car. Position emissions tomography. What this is known as a PET scan. It's a visual display of brain activity that detects radioactive forms of glucose while the brain performs a certain amount of tasks. So it's a method for analyzing activity in the brain, and they usually inject you with sugar. And what they can see is that they watch for brain activity. They use this sugar, the glucose, to identify the hot spots. So you may lay inside the PET scan machine and they may inject you with a certain substance, and then they're going to watch particularly where your brain is active, maybe if they ask you a series of questions or not. Like a weather map shows a storm that's coming, this shows the activity that's taking place in your brain. An MRI, magnetic resonance imaging. MRIs use magnetic fields and radio waves to produce computerized generated images that distinguish among different types of brain tissues. So an MRI is mostly used to detect what's going on with the brain tissues in your brain. MRIs are also used for different body structures. You may have had an MRI done if you tore something in your knee and they wanted to examine the muscle or the tissue that's there. It helps detect abnormal tissue or tears. Like a CT scan, unlike a CT scan, which uses magnetics and radio waves to create images, no X-rays are used in an MRI scanner. Okay, so the CT scan, which we kind of talked about before, CT scan is going to help, it's the CAT scan, it helps detect the bone structure. This one's going to help detect the brain tissue. So if you have a torn muscle, okay, or let's say they want to look at the tissue like an abnormal lump, okay, that's maybe taking place, it's going to help detect that. An fMRI, researchers will be able to communicate with the patients on an intercom system. They go into a machine, and the image of the brain depicted with a lot of different colors of the rainbow, the amount of blood flow in each part of the brain. So kind of like a PET scan. This one's a little bit more active in terms of the blood flow. They're watching blood flow instead of the glucose activity. It's a newer technology that can only reveal the structures as well as the brain functioning. Here it says it's a technique for revealing blood flow and therefore brain activity comparing successive MRIs. So what I would make sure you know is I would make sure you know the difference between an EEG, a PET scan, a CAT scan, an MRI, and an fMRI. Okay, so if I gave you a couple cases in class, would you be able to explain to me when you use each case?